I don't find joy in a lot of things anymore. I did not want to get together with my friends because I was so exhausted mentally and physically. Didn't have time to do it anyway.
Hello, everyone. This is Dr. Anita Leung. I'm here with my friend, Dr. Mary Leung. She's a hematologist oncologist and she works in New York City. We are going to talk a little bit about managing time, managing busy careers as a physician. Or for those of you who are in our audience who are not physicians, just managing your life, managing your career. Dr. Leung, please tell us a little bit about yourself. Tell us about your medical practice, first of all, and how you decided to become a hematologist oncologist.
All right. Thank you, Anita, for having me today. So I think my journey is pretty straightforward, I would say, in terms of I just wanted to be a doctor when I was a very young age. Both my parents are physicians, and they're really great examples for me to be someone who wants to just help other people. And I thought that, you know what, that seems like the best way to help other people when they're not feeling well and all. So then I just followed a path, studied hard, went into medical school, residency, and then I chose to be in internal medicine because I thought I could be choosing a lot of different subspecialties afterwards if I wanted to, or if I wanted to just do general practitioner, that would be an option too. During that time, I was really interested in hematology because I thought that sometimes just looking underneath the microscope, I would be able to really figure out what the diagnosis was. So that got my interest in hematology. And in terms of the oncology aspect of things, it was more like, I think as a personal experience when I was in college, my grandmother, whom I was really close to, passed away quite suddenly at that time. It was really, looking back, there were actually signs that she was losing weight, and because I was already studying away from home and I didn't get to see her probably 6 months, and I noticed that she lost a lot of weight. And then just happened that during the summertime when I went back to visit her, she collapsed and got into the hospital, and within 10 days she passed away with some sort of metastatic cancer. And at that time, because my mother didn't really want to deeper into the diagnosis because it was really end stage, I guess one of the doctors did an x-ray and they saw like all these abnormal bone lesions. So anyway, I think that definitely sparked my interest into getting into knowing more how to help the patients who have chronic disease, especially cancer, to really go through the journey, because cancer for the most part has a time limit. You can guesstimate at least to see how long you have, as opposed to sometimes if you pass away from heart attack or stroke or anything like that, it's a very sudden thing sometimes. And a lot of oncology patients go through not just the physical changes or the hardships, but also a lot of emotional and mental challenges along with their families. So I think for me, it really brings me joy to be able to go through that journey with the patients and their families and be able to help them in both the disease and also the emotional well-being.
Wow, your journey has been incredible, and to already face so much adversity at the beginning of your medical journey and seeing your grandmother pass away, that must have been extremely challenging. But it's also impresses me, I don't know if that's necessarily the right word, that you also find joy in the journey of going through this difficult time with your patients. I think you have to have so much empathy, and I think empathy is the thing to be able to handle all the challenges your patients face and your patients, of course, families face through the diagnosis or managing the diagnosis of cancer. So it's interesting, despite being a busy mom, a hematologist, oncologist, you are also a life coach. Tell us about how you decided to become a life coach.
Yeah, so as you mentioned, I've been busy since after fellowship to be a physician attending. And I think my journey is, first of all, I must share that I never thought that I would be a life coach for physicians. And what happened was that as the years went by, I just found found myself busier, and the workload was getting more and more. And my life just became more like going through the motions. Just wake up in the morning, go to work, see my patients. And then at the end of the day, after seeing my patients, do my charts. And a lot of times it would be in the evening time. I'll go home to see my kids. And then after they go to bed, I will be charting more. And then sometimes in the weekends, I will be also doing the patient charts. And for me, it just slowly have become something that I do not like. More the charting part, not the patient interaction part. I really enjoy interacting with the patients, but then because of all these burdens, I don't find joy in a lot of things anymore. I did not want to get together with my friends because I was so exhausted mentally and physically. Didn't have time to do it anyway. And also I found myself like not really able to connect with the patients the way that I wanted to, because I was just rushing and I just wanted to have some time for myself. So that fast forward to the pandemic, and that was when everything was in a pause. And at that time, because I would still be seeing patients, because especially the oncology patients, some of them we just couldn't delay their treatment. Of course, those we saw the patients. And so I ended up seeing maybe a third of the number of patients that I normally would see. And that felt wonderful because I was able to go home on time, or even earlier than on time. And I had time to do other things, to spend quality time with my family. I baked together with my daughter and do all these different things that I didn't get to do. And I just realized that, wow, I was really a lot happier. Not that I wanted the pandemic to happen, but I also believe that every bad thing that happens, there's always something good that comes out of it. And I think that for me, it's really a blessing in the sense that I got a taste of what going home on time. And I really wanted to continue with that when I would be going back to seeing the same number of patients as I did before. So at that time, of course, since I had extra time to spare, I also stumbled upon something called life coaching. Never knew what it was. And then I just wanted to explore more. So then I did, and I joined a group coaching program by women physicians for women physicians. And so that's where I learned really more of the mindfulness, the emotional intelligence, and all these things. And I was really having help by one of the coaches to help me with really being more efficient in my day, in my clinical day, especially with the charting, because I realized that was really one of the biggest things that was the obstacle for me to having my own time, having my own emotional health compromise. So at that time, that I would say within 3 months, I was able to really cut down my charting time to, instead of going home past 7 o'clock, still with charts undone, I was able to go home by 5:30. And at that time, I was already back to seeing the same number of patients as I did before. So average about maybe 25 patients a day. And I thought, wow, that's amazing. I actually had time to think about what to do after work. I would just say that also around that same time, I joined a life coach certification program, only because I wanted to learn more about life coaching, because it just made so much sense to me about how we think about things and how our emotions are affected by how we think. And of course, how we act really based upon our emotions. So I did. I joined and got certified to be a life coach. And then I thought after the certification was that now that I have really more extra time to spare, and I see that so many physicians are burned out there. If they're not burned out yet, they will soon be, or they're just really stressed and overwhelmed with the long hours, the extra hours that they need to use for administrative work, for charting, and all these things. And these are, especially if you're employed physicians, these are hours that you're not paid for because you're salaried. And so I decided that why don't I also help these other physicians to have the charting efficiency so that they get to go home on time and enjoy life outside of medicine too. So that's how I also started life coaching for physicians.
Wow, your journey is incredible, and you made so many shifts in such a short amount of time. Like the pandemic was, it's actually coming to 4 years ago now. But in that time, to go through coaching, to improve your charting efficiency, and then to realize that you want to help other physicians, to go through life coaching certification and then launch your program to help physicians. That's a lot of transitions you've made in such a short period of time. And you also mentioned something about burnout. I'd like to ask you a little bit more about burnout. What are some of the common signs and symptoms of physician burnout, and how can doctors perhaps prevent it or overcome it?
Yes, I mentioned burned out, and I'll just say, looking back at my own journey, I was really burnt out. So I think one of the biggest things is that you feel exhausted, both emotionally and physically exhausted. And some of the things I like, as I mentioned before, it's whatever you used to enjoy doing, you no longer enjoy doing. And also you just feel like you're not able to really connect with patients or friends or family the way that you want to. And I think that also the dissatisfaction at work, like what used to bring you pride and joy, you no longer experience those things. So I think for physicians and even non-physicians in general, these are like the main signs and symptoms of burned out. And in terms of how to prevent it, is I think one of the most important thing is really to realize and be aware of how you're feeling, and being, instead of pushing away your unpleasant emotions, I think it's important to allow yourself to feel all different kinds of emotions, be it pleasant or unpleasant, good or bad. And I think by doing that, say, just realizing that, oh, I feel overwhelmed, for example, and just go back a step and say, why am I feeling overwhelmed? And is it because that I think that there are too many things to do and I don't have time, or is that something else? So, and I think that I want to also have this opportunity to point out that it is not really the situation that is causing you to feel the way that you feel. It's really because you have an opinion about the situation. For example, it's, as a physician, there are, say, 40 patients on your schedule. And when you are used to seeing, say, 25 patients a day, you will have a thought thinking that, 40 patients, that's too many patients to take care of, to take good care of. So because you're thinking that way, that you may feel overwhelmed or stressed or any of these unpleasant emotions. So I think that being aware of what you're thinking, what you're feeling, is really the important initial steps to figuring out how to prevent you from experiencing burned out. Because then you can go to the next step and say, okay, is there anything I can do about it? All right, it's because that I have this opinion about my work situation. Is there another perspective that I can use to really change the way that I feel about the same situation? I would just say look into that first, because there are always more perspectives that you can choose. And sometimes your brain is just fixed in the default thinking that without the curiosity or the open-mindedness, that you may not be able to see it. But at the same time, is that the more you explore, the more you're curious about it, the more you're going to find things to say, oh, I can think of it this way instead, or I can think of it that way instead. And then you can choose to say, okay, do I like to think of it a different way? And maybe after all these exploration, you may still think that it's still too much work for me to do. And then you can figure out, okay, how can I change the situation? So I guess the whole point is that before going straight to saying that, oh, I need to change the situation, process your emotions first, because without that, you will still carry that unprocessed feelings with you no matter what situation you're at, and you'll still be burned out even though your situation is changed.
Thank you for sharing that. I think it's very important to take the time, as you're saying, to process our emotions. I think a lot of us, especially as physicians, or even if you're in another career, or you just have a busy life, I think a lot of us go through life running through it and we don't take the time to even process what we're feeling. And I love your point about analyzing our thought process about a specific situation. That I think that's extremely powerful, because I think oftentimes we get stuck in a rut, and whatever the first first thought comes to us about a certain situation, we're like, this is fixed, this is what it is. But you're right, there are other ways to look at it, and it's a muscle. I think it's really a muscle that we can use, and we can become stronger and become better for doing that. So I think another question I'd like to ask you is a little bit more about mindfulness and meditation. What are some mindfulness and meditation practices that anyone, a physician or anybody who's very busy, can use to improve their overall well-being and their health?
Yeah, so I think that, and thank you so much for bringing that up, because I think being mindful, it's a very simple thing to do. We just have to, as you mentioned, have that muscle, just exercise and build that muscle. So mindfulness is really just to be aware of what you're thinking. That's it. So it's like you're thinking what you're thinking, basically. And the more you think about it, because there are just so many thoughts that will pop out in our mind, and most of them we're not aware of if we don't think about it. So you just have to really spend a second or two to think about what you're thinking. And I think sometimes even when you're driving or in the shower, things like that you normally would do anyway, to practice the mindfulness is really helpful. I think you probably heard that a lot of times really random good ideas come from the shower, because that's when you can really quiet down. You're not really disturbed by all the hustle and bustle and all the chaotic things. So that's really an important thing. You can just set aside even a few minutes of your day. I know everyone is busy. It is important to even have 5 minutes of the day to be quiet down. And I view that the meditating part and being mindful, they can go hand in hand. You just think about your day and be mindful of your feeling. And also the other thing is also just have the awareness of your surroundings. Just quiet down and say, if you're in the shower, just feel how the water it's beating on your body, what the temperature is like, or how when you're standing up at the bottom of your feet, how does it feel? Or if you're walking outside, what is the temperature of the air, the breeze, the color, all these little things, and just practice that mindfulness. And because, that way it's like you get more peace that you experience, and even just have your mind decluttered. That is really a helpful practice to really minimize the burnout and overwhelm situation. And second is really it's a time for your brain, for your mind to be refreshed and recharged, especially if you do it in the middle of the day. Then you'll have more fuel to go on to continue the second half of the day.
Absolutely. I love that. And I love you also reminding us to do that in the middle of the day. I think a lot of us, when we're fairly busy or overwhelmed, will find ways to disconnect that are not productive. For example, yesterday I found myself in the middle of the day. I was running a little bit late. Then I'm like, let me just go online and scroll a little bit. Let me go on like Amazon. So I think what would have been more productive would have been to just sit back and just relax, just not think anything. Sit in the moment of, I'm here, I'm okay, it's okay. So I think being very mindful of the breaks we take rather than probably breaks that are not so productive. Because I think in those times when you're scrolling online, you're more likely to start comparing yourself to other people or start shopping, of course, with all those Black Friday sales. So yeah, I think for our audience, I'm Canadian, so we did have the benefit of Thanksgiving. But of course, as Canadians, I've noticed that we're more and more into Black Friday. It was not, for me growing up, was not the culture here, but I'm digressing. So I'm focusing on the questions I wanted to ask you. The next question I'd like to is, how can doctors achieve a better work-life balance without sacrificing their professional commitment?
Yeah, so I think that's basically, it's like my journey and how, and this is exactly what I want to help, other physicians achieve the same thing too. So I think one of the biggest things is to really ask yourself, what do you want? What is your goal? Because I think that it is very important to do things in alignment with your values. So say, for example, for me is, of course, I want to take great care of my patients. At the same time is without sacrificing my mental health. And also I want to spend time with my family. So my simple value is really to take great care of my patients and have time to spend with my family. So that's my goal. And for physicians out there, it's important to ask, okay, what do you want in your life in general? And I think that's really the first step, is to know what you want. And then you can go backwards in the sense that, okay, how can I design my life or my work to fit what I want. You may not be there yet, and it's okay, but at least you have a direction, because the goal is really the direction for you to go. And then, because I would just say that people are overwhelmed, stressed, and burned out when they're not doing things according to their values. Just when I was working more hours that I wanted to because I couldn't spend time with my family, that was really something that made me really uncomfortable, not to mention that it really caused me extreme exhaustion mentally and physically. And then, of course, the second thing is to prioritize. If you want to do a lot of things, there will be so many things that you can do in the day that you won't fit it all in the day. And that's okay. Allow yourself that you're not the superman or the superwoman, because we're not. And we're human beings. We're not perfect, and that's okay. And I think prioritizing, it's like the must do kind of, it's nice to do, or they're optional type of thing. It's important. And of course, the other thing is efficiency, right? The work efficiency is so important, because if you're doing the same amount of work, but you're doing 2 hours less than you normally would do, that's 2 hours of your time that you gain back. And you can do a lot of other things if you choose to, or you can just choose to relax. And so I think that being able to balance that is really important. So, now that I'm able to actually, since I shared earlier that I was able to achieve going home by 5:30, now I'm actually consistently going home before 5 o'clock. So it's really amazing, because what brings me joy is, of course, yes, taking great care of the patients and also spend time with my family. And what brings me also, a lot of joy is to be able to help other physicians with charting efficiency, and so that they can experience what I experience in their own way, to enjoy life and even enjoy practicing medicine again. Really, to summarize, is really know your goal, know what you want, and go backwards to say, hey, it's my life the way that it is now. Is that in alignment with my values? If not, what can I do about it? What can I prioritize in my life to achieve that? And how can I be more efficient to do that? And if you don't know how to be more efficient, then that's okay. That's why it's okay to ask for help. Ask someone who has been there, done that, to help you. Not necessarily me. If you find me, that's great. But for someone that that you feel that you resonate with, that you feel connected with, to help you. Because I think that if we can all be happier, if we can all be really taking care of ourselves, then we can take better care of our patients, of the people around us. And it's really this ripple effect that is affecting more and more people as you talk about it. So I think that it is just important to know that, yes, I would just say that in terms of quote unquote the work-life balance, it's not really that you're standing on a scale with one side work and one side is life. It's not like that. It's really like a mosaic, in a sense, or a little puzzle that you put to say, okay, maybe some days you may be doing more work, and some days you may be more of the outside of work thing, but you overall kind of in the mishmash that is fitting for you, that you feel at peace with.
Thank you for sharing that. And also thank you for sharing the point that it won't be like a perfectly balanced scale. Some days people will focus more on work, or some days you'll focus more on your family or self-care. I think that's a very useful tip. And speaking of tips, do you have any other advice or tips for physicians that are early in their career?
Yeah, so I think that I really wish I learned all these things earlier on, or even in medical school. I think the emotional part of things is, I think it was implied that we individually, physicians, don't really matter. It's all about patients. It's like patients first, you care about the patient and all. But realize that if you don't take care of yourself, you can't give what you don't have. So it's so important to really have that mindfulness and realize how you're feeling and how it is affecting what you do and how you take care of your patients. If you really feel exhausted, and that's normal, that's okay to feel the way that you feel. Don't push that away if that's what you're feeling. And and really earlier on, just if you think that you can't handle it yourself, just ask for help. Ask your mentor, ask your colleagues, or ask a coach, anybody. Because I think that by asking for help, you're reaching out, and that it's okay, that because yes, we're physicians, and at the same time as we're human beings, we don't have to know it all. We're not perfect, and that is okay.
I think that's great advice, especially with the way we're trained in the medical field. And especially during training, you feel like you have to be perfect. You feel like you have to know it all. But I think it's a good reminder that we're humans as well. And we will not always be perfect. And we have the opportunity to ask for help if we just open our mouths and maybe humble ourselves or just look for people who seem friendly. Dr. Mary, thank you so much for taking the time to speak with us. There's a few other questions I'd like to ask you, so I'd love to have you back on the show. But in terms of, in order to respect your time, I'm gonna wrap the show to a close. But before we do that, I'm sure there are a lot of physicians out there who are intrigued by what you're saying, who are struggling with their charting, who need a little bit more help enjoying life. For those physicians who want to reach out to you, how can they find you?
You can find me. I have a website, and my company is Shining with Gratitude MD, because I'm just so grateful for my life and for what I have done and become and helping other physicians. So my website is www.shiningwithgratitudemd.com, and I do post a blog post twice a week, and feel free to read those. And I also have a free guide to burnout on my website that you can grab. And in terms of my email is shiningwithgratitudemd@gmail.com. And I'm also on Facebook, Mary Leung, and on LinkedIn, Mary Leung MD.
Thank you once again for taking the time to talk with us. We'll definitely have you back, and we will ensure that we have all your contact information linked below the show. And to our audience, thank you so much for watching. If you have any questions for Dr. Leung, please reach out to her, and we will be back with another show. I'm not going to tell you what it's about. You're going to have to listen to the next show to figure out what we're talking about. Bye-bye for now.
Thank you.
Thank you.